Chief guest of today's inaugural function, Honorable Chief Minister of Goa, Shri Lakshmikant Parsekarji, Honorable Minister of State Independent Charge for AYUSH, and also Minister of State for Health and Family Welfare, Shri Shripad Yesonayakji, Honorable Speaker, Shri Anil Ji, Honorable Deputy Chief Minister and Health Minister of Goa, Shri Francis D'Souza, Honorable Minister of Forests, Shri Rajendra Arlekarji, Honorable Minister Alina Saldana ji, she is Minister of Science and Technology, Honorable Leader of Opposition, Shri Pratap Singh Rane, Secretary Health, Shri Sudhir Mahajan ji, Head of CIA in Goa, my colleagues from the Ministry, Director Generals of different research councils, Directors of National Institutes, advisors from the Ministry, Deputy CEO, National Medical Plant Board, senior officials from the State Government of Goa, principals, students of Ayurveda homeopathic colleges, other officers from the State Government, friends from media and press, ladies and gentlemen, it is indeed my great pleasure and honor to be part of this momentous occasion, the inaugural session of first ever National Arogya Fair on AYUSH in the beautiful state of Goa. At the outset, let me extend once again warm greetings and welcome on behalf of the Ministry of AYUSH to all the dignitaries on the dais, all the distinguished guests who are present here. So, very briefly, I would say something about the ministry. As our compere has mentioned, that this ministry was elevated to the status of a full-fledged ministry in November 2014, and Honorable Shripad Nayak ji happened to be the first minister of this new ministry. Sir, if we look at the infrastructure we have in AYUSH, it is comparable to the modern system. We have got 7.36 lakh registered medical AYUSH practitioners all over the country. We have got 556 colleges of undergraduate and postgraduate, out of which around 160 are postgraduate colleges, and the number of annual intake is about 35,000 combined both UG and PG. So every year we are producing 35,000 doctors, qualified doctors. I am not talking about yoga and naturopathy because that is a different stream. Basically, those are imparted through university degrees. But these are registered medical practitioners who are allowed to do medical practice. This 7.36 lakh, as I mentioned. And we have a huge presence in our public health delivery system. If you look at the number of total primary health centers across the country, we have 24,448, out of which 10,042 primary health centers have AYUSH doctors, either Ayurveda or homeopathy or Unani, depending upon the states, the local felt needs. Then we have 5187 community health centers across the country, which have, out of which 3,153 have got AYUSH doctors. We have 763 district hospitals, and our presence is in 501 hospitals. So if we look at this number, this looks very impressive, that yes, we are part of the healthcare mainstream in the country. But unfortunately, that is not the situation. Recently, 3 years back, we got one survey carried out by National Sample Survey Organization. It was in 12-13, and after in 13-14 also, part of some questionnaires was there on AYUSH system, and the results were not very encouraging. Only 5 to 8% people across the country, they are having AYUSH systems as a preferred system of treatment. Despite having such a robust infrastructure in place, the people who are availing these facilities at the PSC level, CSC level and district hospital level is dismally poor. It is only 5 to 8% combined together at the CSC, PSC and district hospital level. And this is despite the fact that these are our system. We have been using this part of Indian ethos, part of Indian culture, and they are there for thousands of years. Ayurveda is there for thousands of years. Unani is there for 1,000 years. Homeopathy is there for 200 years. Yoga naturopathy, absolutely, there is no, we can't prescribe any year for them. Despite that, our presence, we have huge presence, but despite that, people's liking for these systems is yet to be achieved to a desired level. And for that, ministry under the able and dynamic leadership of Honorable Minister, we have embarked upon a very aggressive, basically awareness campaign that people should be told about the strength of these systems. We have research councils, 5 research councils are there for each system, and we have 80 units spread over across the country, which are carrying out research in different disciplines: cancer, non-communicable diseases, diabetes, and they have developed patents. Unani has developed 8 patents so far. CCR has developed so many patents for different diseases. So, purpose was that we must tell the people, we must offer this basket that yes, these are the strengths, but this is a lot of research has gone into now these systems. These are not only traditional, but these are scientifically validated, scientifically now endorsed systems. A lot of science has gone into these systems. So that is the purpose of organizing these fairs, and we sponsor so many seminars, workshops, so that people should know what Ayurveda has got to offer, what homeopathy has got to offer. Of course, the main task before the ministry is that we should be able to meet the scientific scrutiny which is demanded by our friends from the modern medicine side, not only in India but across the world. And that's why we are also now focusing on our reorientation of research priorities in our research council, so that they can meet the demands of the modern doctors. We are entering into collaboration with the different other countries. Recently, we have been able to break ice with the US. We had a 2-day international conference on traditional medicine, where the health secretary of the country, the assistant secretary of state health, and all his team from National Cancer Institute and other reputed institutes of USA, they came for a 2-day conference. So basic purpose of all these exercises is that we should tell the people that we have a very strong system of our own traditional system, and which is complementary. It is not that it is saying that don't follow allopathy. Allopathy has got its own strengths, but at the same time it has got its own limitations. So the need is to join hands for these 2 systems, and that is what the ministry's task is. So with these words, I once again thank all our distinguished dignitaries on the dais, all our distinguished guests here, students and faculty from all the colleges, and our friends from media and press. Thank you very much.